thin, flat, non-existent, asymmetrical. These are just some of the common concerns that I hear from my male patients coming in for lip filler. In today's episode of Dr Nora, I take you through everything you need to know if you're a male and considering having your lips injected. Now, some of you out there might be thinking, well, lip fillers, that's only for females. Well, no, actually, hold your horses right there, because as a cosmetic injector, I'm seeing an increasing number of men coming through my doors asking for lip fillers. This could be due to a number of different reasons, and primarily because, you know what? Fillers are okay. They're really accessible, and as long as you get a good provider who knows what they're doing, then generally speaking, you should get a good cosmetic outcome. Before we delve into the common reasons why men might have lip fillers, let's talk about the difference between the male and the female lips. With females, we tend to see that their lips are plumper, smaller, and they tend to be more centralized. Whereas with men, however, they tend to have longer and thinner lips. And the distance between the upper lip and the nose is actually quite further than the distance between the upper lip and the nose in a female. Okay, so now I've established the differences between the male and the female lips. What are the common reasons that men may present for lip fillers, and how, as a cosmetic injector, do I achieve those outcomes? Now, before we get going, of course, as always, if you are yourself considering any invasive procedure, such as having a lip filler, please know they do carry risks, and ensure that you do seek the second opinion of an adequately qualified cosmetic practitioner, because, as you'll soon find out, there are quite a few things that need to be taken into consideration. It's not quite as easy as a dib-dob-dab. Actually, there can be some serious side effects, and certainly the cosmetic outcome may not be particularly desirable, particularly if you're trying to achieve a result that looks street-worthy. Now, when I'm talking about lip fillers today, these are dermal fillers that are non-permanent in nature. They're comprised of something called hyaluronic acid, which we naturally have in our bodies. And the outcome of this is that the man-made hyaluronic acid actually integrates in with your own hyaluronic acid to produce a nice plump appearance. And as it says on the tin, they're not permanent, so typically they may last up to 6 to 9 months in this particular area. And again, they're not suitable for everybody, so please make sure that they are suitable for you by having a chat to your own cosmetic practitioner. But let's dive into the first reason of why men may get lip fillers. The first reason is that men may desire a more feminine lip. Now, this could be due to a number of reasons. Perhaps they just prefer the plumper look, perhaps they're going through some physical changes themselves and they'd like their lips to look a bit more feminine in nature. As a cosmetic practitioner, it's really important to do a full facial assessment. And as we mentioned before, the differences between the male and the female lips is that the female lip tends to be plumper, smaller together, and actually the distance between the upper lip and the nose is shorter. And so we must take this into consideration if we are considering feminizing a man's lips. Typically, we'll inject into the central aspect of the lip. So here we have a very rough sketch of a man's lip. As you can see, they're very thin, they're long, and they're quite flat as well. So in order for us to make them into a feminine lip, we have to actually see that person probably a few times with a few mils of filler over a period of time. Because the idea is that we want to do some injections into the central aspect of the lip. So that means into this area here. And generally speaking, we tend to draw an imaginary line from each of the nasal flares downwards and concentrating in this area over here. We don't want to inject the lips too widely, otherwise they'll look a bit like sausage lips and they won't look very pretty. Now, of course, if that's what you're after, then just make sure you tell your cosmetic practitioner. When we are feminizing the lips, usually men tend not to have a very strong cupid's bow. And so injections will be concentrated around the cupid's bow, trying to make into a nice little arch there, and also into the body of the lip. And the reason for this is that we want to plump up the lip to give it as much volume as possible, because, as I mentioned before, men's lip tend to be really quite thin. There's a few ways that we can increase the volume of the lip, and as I mentioned before, we can certainly inject filler into the body of the lip to help to plump it up, but we could also potentially perform procedures such as the lip flip using anti-wrinkle injections to the upper lip over the skin of the upper lip, and that helps to evert or roll the lip out. Of course, this isn't permanent by any means, and this will only last about 3 to 5 months, and so that person may have to come in and have another procedure in about 3 or 5 months to continue that lip flip. But the outcome will be that their lips look more everted, they look plumper, and they look smaller than sort of the wide natural appearance of the lip. So that is a feminization of the lips. But what about the opposite? What if a man wants to come in for the masculinization of the lip? Certainly, I do see this in practice, and generally speaking, this could be somebody who doesn't really have much of a lip, and we'll go into this in a bit more detail, or they want to show their lips off to the world because they are non-existent. And we must make sure that when we are considering somebody who wants to have masculinization of the lips, again, we know the differences between the male and the female lips, and we don't accidentally inject them to make them have a lip that looks feminine in nature. So going back to basics, we need to make sure that if we are injecting a male's lips to make them look more masculine, that we continue to inject around the whole of the lip, because as we said before, men tend to have thin and long lips, rather than focusing our injections into the central aspect of the lip, we sort of try to keep the lips looking wide and longer. And certainly you may not use a whole lip filler, it just depends on what the person looks like and certainly what the facial assessment looks like as well. But you may want to do some techniques whereby you may do some fanning techniques where you go into one injection point and fan the threads of the filler through the lips, and this will help to bring out the lip nice and long, so it's looking a lot flatter and not looking too plump. If you do make their lips too plump, then of course we're going into that territory where we're feminizing their lips. So it's really important that if you are considering this for yourself, to make sure that you see somebody who actually knows what they're talking about. When we are doing masculinization of the lips as well, again, we don't want to focus too much on the cupid's bow, because naturally men don't tend to have a strong cupid's bow, and so your cosmetic practitioner might do a few injection points around the cupid's bow, but certainly that shouldn't be a real focus point, unless of course you've asked for it. Now, even with male lips, there is still a golden ratio, and certainly speaking, we don't want the lips to look unnatural by any means, of course, unless that's what you want to do. But certainly to keep a natural looking lip, we want to have a good ratio between the upper and the lower lip, and generally speaking, our upper lip tends to be slightly smaller than our lower lip, and this rule applies for men and females as well. And the golden ratio is 1 to 1.6, meaning that your upper lip is level 1 and your lower lip is 1 and a sixth of what your upper lip. So it's slightly larger than the upper lip, and this looks quite nice as a profile as well. Of course, with social media emerging, these ratios kind of can go out the window, and certainly these ratios could be different. For example, it could be 1 to 1 depending on who you're looking at and who's in fashion on Instagram or Snapchat at the moment. So one of my important takeaway points from this video is, if you are considering any lip fillers for yourself, make sure that you have a clear idea in your mind what it is that you want to achieve with reasonable expectations, and make sure that you present that to your own cosmetic practitioner so that you're both on board with the final cosmetic outcome. The third category that I commonly see in my practice is restoration of the lip volume. This typically tends to be an older chap, for example, who has noticed as the years gone by that they had a really nice visible smile, and naturally we're all, regardless of your gender, are susceptible to this, is that the fat pads and the volume of the lips and other facial structures decreases and diminishes. And so the net outcome of that is that when you smile, you may not see your lips being present as much as they were, say, 20, 30 years ago. And so these patients will typically present with a situation where they say, oh, you know what, I've had a look in the mirror, or I see these photos of me and my lips just look so thin and flat and they're non-existent, and you can really see my upper teeth now and my gums because the lip volume has decreased so dramatically. And so in these patients, we really need to clearly assess to see how much volume have they lost and what would look good for their own facial structure, as well as keeping in mind whether or not they want to have a masculine lip to maintain it, or whether they want to go into a more feminine lip as well. So there's a few points that need to be addressed if you are considering restoration of your lips. So over here I've got a really good example of somebody who wanted to restore their lip volume, because when they were smiling you could really see their upper teeth, and their upper lip essentially was just no longer existing. And that person felt very aware of their face, and obviously this can happen if you're very social, and if you're in lots of social groups and you're taking lots of photos and you reflect back on the people who are in your photo, you might think, my smile just doesn't look as good as so-and-so smile. And so typically these people will present with a desire to restore their lip volume. For this particular case, I didn't have to inject too much into the lip, only really 0.5 of a mil, so half of a syringe, into the upper and the lower lip. And again, my technique was that, in order to maintain that nice sort of masculine lip, I'm not going to inject too centrally, but of course doing my injections a little bit more laterally, so on the outer side, to keep those lips looking a bit more flatter and longer as well, maintaining that masculine appearance. But naturally, of course, in order to restore the lips, you have to inject some volume into the lip itself, and you do this by injecting into the body of the lip. And certainly if there is any loss of definition of the lip as well, we may consider injecting into the vermilion border, which is the border around the lip, in order to define the lip, which is something we commonly do with females as well. If they have, for example, a situation where they put their lipstick on and it bleeds into the surrounding skin, men may also request for definition of their lips as well. Then we go on to the last category, which I define as special requests. These are people who come in who are generally happy with their lip shape, but there's a few asymmetries perhaps, or they want to have a few tweaks to their lips to give them that optimal result. This could be somebody who, as I said, has an asymmetrical lip, and this takes a really trained cosmetic practitioner to be able to inject properly into the lip to make sure that there are no further asymmetries, because often what happens when you are injecting somebody who has got asymmetrical lips, you find yourself chasing asymmetry, so you're constantly running after that asymmetry, and so then you end up having a further asymmetry after it as well. So this can be a really challenging patient to treat, and it really does take a bit of a trained eye to make sure that you're not over injecting into that asymmetrical area, and then creating another asymmetrical area on the other half. So with this, if I do have a patient who presents with an asymmetrical lip, I do tell them that we might have to do this over a few sessions, and we might have to put a little bit of time and just reassess as we go along. Because as you know, when we do inject the lips, they do swell up, and so everything looks a little bit distorted and a bit different once you put the needle inside the lips. And so this may take a little bit of back and forth with your cosmetic practitioner to achieve your final outcome. In some situations, some men like the shape of their lips, but they want there to be a little bit more volume, or they want their lip to be a little bit more turned out or rolled out. Now we can see this in this picture over here, whereby he had a really good baseline for a lip, but he wanted his upper lip to be just a little bit thicker than it was previously. And the reason for this is, again, usually it happens when they're smiling, but when he smiles, his lip sort of disappeared as he was smiling. As you can see, the smile is a common complaint for patients, and many of them will come in because they've noticed on a photo that their smile just doesn't look right and they want to fix it. So it's really important that your cosmetic practitioner sees you when you're smiling, as well as in real life as well, when you're expressing and talking with your lips, so they can see how your lips move and how they disappear when you are talking too. So for patients that just want to have the upper lip volumized, it is really important to ask that patient whether or not they want to maintain their masculinity of the lip, or if they want to feminize it. With this particular situation, we didn't want to feminize the lip, we just wanted to roll out the lip and maintain that masculine appearance. And so that means that as for a cosmetic injector, that we're not going to focus all of our injections into the central aspect of the lip, but rather we're going to still do some in the central area of the lip, but we're also going to inject laterally from the lip as well. And this will help to maintain that natural aesthetic of the lip, to keep it nice and long and flat in appearance. There's a couple of techniques that we can do to help to roll out the upper lip, and certainly injecting into the body of the lip is something that we do to help to increase the volume. But if we want to invert the lip or roll it out, then generally what we tend to do in some situations is we inject into the wet and dry border. If you all take your finger just now and you have a feel of your lip on the top, and you'll feel it's quite dry over here. If you then roll your finger down into the bottom of your lip, you'll feel it's a bit more moist and sticky. The point at which the dry bit of the lip and the wet bit of the lip meet is called your wet and dry border. It's a no-brainer, isn't it? So in these situations where we want to increase the volume of the lip by rolling it out, we can inject into this border. Now, it's really important that, again, your cosmetic practitioner has done this before, because this can go wrong. And essentially what can happen is, if they do this incorrectly, you may end up having some lumps on your wet and dry border when you smile, which doesn't look very nice. So other things that we can do to invert the lip or roll it out is we can actually do something called the Russian technique. Now, I'll drop a link in the description below of how I do the Russian technique, but note, this is only a technique that can be done in people who have not had dermal filler before, because it just doesn't work as well. But essentially it comprises of putting small micro injections into the top of the lip, over the border of the lip, and helping to evert the lip or roll it out. This does give the appearance of a slightly thicker lip, upper lip, and you can even do it for the lower lip as well, but it helps to roll out both of the lips to give them that nice sort of everted appearance. In saying that as well, we could also consider doing a lip flip, for example, as we said earlier. That means injecting anti-wrinkle injections into the upper lip muscle, and that again helps to evert the lip. But bear in mind, this won't last as long as your dermal filler will. Now, you might be thinking, okay, so you inject the upper lip, but what about the lower lip in these situations? Well, I certainly do not leave the lower lip in any situation, because if you don't inject your lower lip and you've injected your upper lip, lip fillers cause your lips to swell, and the lips are very vascular. So that means that somebody could go around for, say, 3 to 5 days with a really swollen upper lip but a normal lower lip, and it kind of just looks a little bit weird. And so generally speaking, what I tend to do is, obviously after a good facial assessment of the patient, I'll take a look at both the upper and the lower lip, and even if it's just popping a small amount of filler into their lower lip just to maintain the ratio, is better than doing nothing, because they will look really peculiar, especially if they have to go to work the next day. So for these particular patients, I do inject both lips still, but my focus is mainly on the upper lip, trying to create that nice everted appearance of the lip. So there you have it. That's my complete guide for lip fillers for men, from what the differences are between male and female lips, and the different categories or reasons why people might present to have their lips done. As I mentioned before, if you are considering these procedures, please know they do carry risks, and some of these risks can be substantial. In fact, in some situations, lip fillers, if injected incorrectly, can cause cell death. Yes, and that is an emergency situation. So it is so important for you to speak to somebody who is adequately qualified in this profession and knows exactly what they're doing. And if an emergency did arise, they also know how to deal with the emergency as well. So please make sure that you are researching your practitioner very thoroughly. Perhaps you're getting it from word of mouth, or you're seeing some pictures of before and afters, and also make sure that you do bring in your own photos to your consultation, so that you have an understanding and an awareness of what you want to achieve versus what they think they can achieve. I hope you guys have found this video useful, and of course, course, if you have any questions or comments, please don't hesitate, drop me a line in the comment section below, and I'll see you on the next one. Take care and stay healthy.